Good morning. Olivia Otieno here, listening to Double O Direct. And please do go to SpiceFM KE. Not just to see my outfit, although it's fly as all hell, let me be honest, right? SpiceFM KE on Facebook for the chance to win yourself some earpods. All details are on @SpiceFM KE, and the earpods are courtesy of Jennifer from Follow Me Talk. But September is Childhood Cancer Awareness Month. And today, when I met, finally, Dr. Doreen Mutua, I was like, I know nothing about childhood cancer, and I'm grateful because no one close to me has ever been affected. So I'm really grateful for that. So I'm going to start off because I have Dr. Doreen Mutua, I have Advocate Fatma Mururi, I have Cindy Ogana from the Faraja Cancer Trust. We're talking about childhood cancers today. Dr.
Good morning to our listeners. My name is Dr. Doreen Karemi Mutua. I am a pediatric hematologist oncologist. That means I basically deal with children who have blood disorders and cancer. I work at the Gertrude's Children's Hospital.
Good morning, everyone. Thank you, Olivia, for having us. My name is Fatma Mururi. I'm an advocate of the High Court of Kenya and a vice chair of the Subi Queens Society. Happy to be here.
Good morning. My name is Cindy Ogana. I'm the fundraising and communications manager for Faraja Cancer Support, which supports cancer patients and their caregivers in Kenya.
Dr. Ari, what are the different types of childhood cancers?
Thank you for that question, Olivia. We have several cancers encased in that big word called childhood cancer. The commonest we have is leukemias, acute leukemias. We have two types, acute lymphoblastic leukemia and acute myeloid leukemia.
Which is the more prevalent of the two?
Acute lymphoblastic leukemia. We find more of acute myeloid leukemia in adults. So the next big cancer is lymphoma. And there are two big groups. We have the non-Hodgkin's lymphoma and the Hodgkin's. Then we have the brain tumors. And the kidney tumors, we call them Wilms tumor. The eye cancers, we call them retinoblastoma. And a big group of tumors in soft tissue, that means bones and muscle, and we call them the sarcomas.
We're going to get into that because we want to understand it for the lay woman, because it's Cindy's like, I don't even know what that means. No, I'm just kidding, Cindy. Fatma, who are the Subi Queens?
Oh, thank you for that question, Olivia. Subi Queens are a Subi Queens Society is a group of women for non-Subaru and Subaru owners
But who are Subaru owners at heart?
Yes.
They don't have it, but they aspire.
Exactly. They're Subaru enthusiasts like you.
Really, if I owned a car, I was just telling her, if I owned a car, Mumbi, we would be cruising, right? Down that bypass. People would even know what hit them. No, we would not hit anybody. Let me not say that. Okay, continue, Fatma.
Yeah, so we are a group of 38 queens who form, they're actually multi-jurisdictional. We're in Kenya, Uganda, Tanzania, and US. We have members in US.
Yes.
Apparently in Maryland. So we have, we are very enthusiastic about charitable work, charitable activities. We actually go ahead and help any person who would want to build up society. We help the girl child, we help the women. We also help the boy child. Apparently, in fact, if in case of any issues that would come up in respect to the development of societies, we join together as queens to help the society as a whole.
Are there Subi Kings? Or just Subaru boys?
Well, that's a good question.
But don't get into that. No, let me not get into that. I want to get a chance to respond. No, but seriously, Cindy, tell me about the Faraja Cancer Support Trust.
So Faraja, Faraja is a registered charity. We are in Nairobi and Eldoret, and we offer free support services to cancer patients and their caregivers. You're very lucky, Olivia. You've never had an experience of somebody close to you with cancer, but it's a very expensive disease to have. So we find that after somebody has gone through the medical side, we come in with the psychosocial side to help the cancer patients cope and to remind them who they are, because they tend to forget who they are based on how vigorous and hard the disease is.
Today we are talking about childhood cancers. It is Childhood Cancer Awareness Month. That's what September is all about. And tell me, Fatma, are you actually a practicing advocate?
Yes, I am. I'm an advocate of the High Court of Kenya.
Yes.
Practicing for almost, I'm going to my 10 years.
Wow.
In March 2022.
So where do you actually work when you're not being a Subi Queen?
I work for Equity Bank.
Excellent.
Yeah, as an in-house counsel.
That's fantastic. You're the second in-house counsel that I have met in the last 1 week. The other is a lady, no, Guarda World. I think they're the security guys. That's yeah, she's also a female in-house counsel. Brilliant, beautiful, just like you, Fatma. I'm having a great time. And when did you join the Subi Queens?
I joined Subi Queens in 2017.
Yes.
I was introduced by a friend who introduced me to a group of women who own Subarus. Apparently, I was in a legacy group before that, which was full of men. So then I was surprised to have Subi Queens, it's a group of women who do amazing jobs and work for the society. So yeah, the Queens actually started their stench in 2016.
Yes.
And then went on ahead to now do the formal registration in June 2021. So we just formally registered as a Subi Queen Society.
What are some of the works that you've been doing in relation to cancer?
So basically we actually do runs. Like we did a run to Kenyatta National Hospital sometime in 2016. We went and gave food care packages for the children there, the ward, who were in the cancer ward. Yes. We also have done a lot of other charitable work for majorly the women and children and girl child. Yes. We went to also Meru and mentored women on different issues that they were dealing with, but not necessarily issues of cancer, because at that time it was more of women, girl child, trying to understand about
what their needs are.
What their needs, exactly.
So Cindy, you are the fundraising and communications manager for the Faraja Cancer Support Trust.
Right.
Give me a brief history of the trust.
So Faraja started 11 years ago, and we noticed that there is a gap in psychosocial support. When I say psychosocial support, I mean you've been diagnosed with cancer. It's already a shock. Because Olivia, if I mention the word cancer, what's the first thing that comes to your mind? Exactly, isn't it?
Yes.
And that's common with everybody, male, female, children. So we saw a gap in terms of allowing the patient to see the cancer different, just as a journey towards recovery.
Yes.
And also giving them complementary therapies to go alongside their medical treatment. Because as I mentioned earlier on, cancer is very hard on the body. They're very funny side effects. Your fingernails turn black, your hair falls off, you get lesions, that kind of thing. But cancer patients don't deal with those side effects. In addition to losing weight and all the pain that they go through. So we offer what are called complementary therapies for free. Okay. And they go along your medical treatment, and research has shown the outcome is better. So these are things like massage, nutrition, exercise, support groups. We also work with the children at Kenyatta. That is why Childhood Cancer Awareness Month is very close to our heart. Yes. We do art and music therapy. Yes. You're a mother like me. You know how kids are.
Yes,
kids,
of course.
Even when they're in pain, the one thing that a child is better is when they play.
True.
So we tap on that innate ability of children to always play and bounce back, and we use art therapy to demystify the cancer journey to children. And finally, we have a medical fund where we support needy patients through their treatment.
Do you also support the families or the caregivers?
Yes, absolutely. Everything we offer in terms of our therapies are also for the caregivers. People forget caregivers a lot.
It's true.
You think about the patient, but the caregivers going through it psychologically and financially as well. So we offer, for example, group counseling, nutrition session. The caregiver has to be there. And in some cases, when the caregiver is very stressed, come in for a massage. Why not? Relax,
I know a lot of people are wondering, where can you be found? Because I had never heard of you.
Wow. Okay. So Faraja is based next to MP Shah. We're not within, we're next to MP Shah. The building is called HCG Cancer Center.
I've seen it. I thought we saw it was part of MP Shah.
No, it's not. It's autonomous. It's HCG Cancer Center. We're on the first floor. That's in Nairobi. In Eldoret, we are at the Moi Teaching and Referral Hospital.
And online?
And online, farajacancersupport.org.
farajacancersupport.org.
Yes.
Dr. you mentioned a number of cancers that affect children. Amongst the most prevalent, what are some of the warning signs?
Okay, so the most prevalent, we'll talk about the acute leukemias and then the lymphomas. So for leukemias, and generally, you can also share some of these symptoms with lymphomas. We tend to see anemia. And anemia is where you have your blood sort of going low, and the child would look a little pale. And if you look at the hands and the and the eyes, sometimes they look a little whiter. So people will tell you,
you have very white eye whites.
Eyes, yeah.
I've been told the same thing.
Yeah, but no. If you look at, and you have to really look at it, and parents do pick it out.
Yes.
And one of the other things that they would see is that the child is very lethargic.
Okay.
They're not playing as usual. Fever that goes on and on and on and on, and it's really not responding to normal treatments. If it's an infection, if it's something else, bone pain. Anytime a child is complaining of bone pain, I think it's something that really we need to put an eye on.
When you say bone pain, what exactly do you mean?
So most children will come and tell you, "Mommy, my leg hurts," or "My hand is hurting." And then they go off to play. Sometimes they don't want even to move that hand, and they'll just sit still with that hand not moving or that leg moving, or you notice a limp.
And there's no bruising.
Yes, and there's no real explanation as to why. You didn't see any fall. They don't say anything happen in school. So if you notice any limping, any bone pain, and then it's consistent, something that they're not saying it and then forgetting about it for months. It's something that is consistently happening.
Okay.
I think it's worth looking at. And then any swellings, because they tend to get swellings in the body. And you asked about bleeding and bruising. Any bruising in a child who really doesn't have a bleeding disorder should raise alarm. Something is going on. And these are things that a lot of parents come in saying, "Oh, I noticed my baby's tummy is looking a little big. Is everything okay?" So that's a good thing to look out for, because once you as a doctor examine, then you can't feel, is there any swelling in there? And basically, we've almost gone through all the cancer symptoms for almost all the diseases. We have it right there.
What about genetic predisposition? What should you look out for? For example, if you had an auntie or an uncle or somebody in your family who had cancer.
I bring in that point because most people ask, what happened to this child? Do we have any risk factors? And when I hear risk factors, is people are trying to think, can we prevent childhood cancer? Because people don't want to have, if you can do something to stop your child from getting cancer, you would.
Exactly.
But unfortunately, we don't have any real known risk factors for childhood cancer, except some inherited genetic syndromes. For example, one that is very common is Down syndrome.
Okay.
And most people walk around and they've never heard that Down syndrome is actually a cancer predisposition. But if you notice about only about 5 to 10% of children with cancer will have a risk factor like a genetic syndrome.
I'm Olivia Otieno. The hashtag is #00 Direct, all about women, female hosts, female artists, female guests. But even as a dude, you can win yourself a pair of AirPods. Get onto our Facebook page for a chance at a new set of AirPods thanks to Follow Me Talk. Yes, I talked to Jennifer earlier and she said, Olivia, we have 2 to give away. So get on there and tell us favorite 90s female artist or group. That's all it takes, and you could be lucky. But being September, we are discussing childhood cancers today on #00 Direct. With me are Dr. Doreen Mutua, I have Advocate Fatma Mwiruri, and I have Cindy Ogana. She is the Fundraising and Communications Manager at the Faraja Cancer Support Trust. I need to know if someone is diagnosed.
Right.
They go to your website, farajacancersupport.org.
Yep.
They find your number.
Right.
They call you.
Yes.
What happens next?
If they're in Nairobi, we ask them to come to our center because, first of all, we need to assess the situation. Usually, if it's a caregiver, they usually call in panic.
Yes.
We need to sort that because, as I mentioned earlier, it's the cancer patient, and the cancer patient and the caregiver. We need to make sure your mindset is all right.
Okay.
So once you come to our center, and then we settle you down and you say, okay, either I have cancer or my loved one has cancer, we ask for medical reports. This is if they need financial assistance.
Yes.
And then based on, we have a criteria that we use to select the people that we support. We would love to support everybody, but it's too expensive. We don't have all the money.
Where do you get actual financial assistance from as a trust?
From donors like Subi Queens who have events, and then whatever they raise, they give to us.
Yes,
You know,
yes.
we have well-wishers. For example, Olivia might decide, you know what, I really love what you guys do.
I really love what you guys do.
Here, take something. And we also have our own in-house events. For example, next month we're doing whitewater rafting. Please come if you've ever been.
I love white water
Karibu
rafting.
Sana, 9th October at Savage Wilderness Camp in Sagana.
Excellent.
So we do all these activities to raise funds, and then we also have people who have passed on from cancer and said, okay, you know, we are comfortable. So whatever is in the will for our father or mother or grandfather, we're going to give towards you to support cancer patients. That's how we're able to survive.
And you were telling me about the journey. So once you've made the selection of who is going to get the support.
Who's going to get the support?
Yes.
We bring in NHI NHIF. NHIF takes in a chunk of the bill, and then
Yes.
we're able to support your treatment if it's radiotherapy or chemotherapy or brachytherapy, which is for cervical cancer patients. We have a special place in our heart for kids.
Yes.
So we also support children if they need anesthesia for radiotherapy.
Wonderful, wonderful. And Subi Queens, you're supporting the Faraja Cancer Trust. Tell me, what events are you planning on having, to give more?
Okay, so we are having actually a pre-event for the cancer awareness. Hashtag Be Bold, Go Gold.
Okay, I can see you have,
yes, representing.
Yes.
So the pre-event is going to be today at 2 p.m. We're going to have a car wash. You can have your car cleaned for just 800 shillings.
Yes.
And it's going to be at Splash Foam Spa. It's behind Toy Market, if you know it.
In Adams Arcade?
It's at Adams Arcade.
Okay.
Yeah. So we're also going to have another event on 11th and 12th of September, being the Cancer Month, Cancer Awareness Month for the children. And during that day, we're going to have a blood drive. And blood drive, in the sense, it's going to be sponsored by Kenyatta National Hospital, whereby people can come and donate, and also donate blood, as well as we're going to also have a car wash, of course.
Yes.
And this will be a drive-through, so we're going to also follow all the COVID-19 protocols.
Yes.
Ensure that you get your car cleaned and just pay 1,000 shillings for vacuum.
Yes.
A royal kind of car wash.
How can somebody get in touch with the Subi Queens online?
So you can reach us on Instagram at Subi Queens. That's the handle. And then we also have a Twitter handle at Subi Queens. We also have a YouTube channel. You can reach us on YouTube channel. The link is going to be provided to you. It's actually at Instagram, Subi Queens.
Yes.
And I think Facebook at Subi Queens as well.
So inviting everybody to come over for the car wash, which is at Splash something in
Splash Foam Spa.
Yes.
At
Adams Arcade.
Adams Arcade.
Daktari, whenever I go back to you and we're having conversation, something that Fatma said about a blood drive for children, is there enough blood available?
So I really love what these ladies are doing, and I'm so proud of you. And basically, just maybe to mention a little bit about childhood cancer in the world and in Kenya, just quickly, is that we have about 300,000 children diagnosed every year with cancer.
Wait, globally or in Kenya?
Globally.
Okay, and in Kenya?
In Kenya, we are estimated, remember this is an estimate, it's about 3,272 cases in a year.
Are the cases increasing, or are we just getting better at diagnosing childhood cancer?
It's a real underestimate.
Okay.
That means when they look at the population statistics, we should be diagnosing about 7,000 children.
So what is causing all of this cancer in our society with our children?
So I think most of the time, because people are hearing more about childhood cancer, remember our children initially were dying because of infectious diseases. We've gotten better at immunization. We have better care. So we're having these children, better nutrition. Our mothers are more educated now. So we're having these children actually getting to live beyond their 5 years. So now they're living longer for us to see cancer. But what is sad is that we have more than 50% of the children who are not ever getting a diagnosis of cancer and dying of their disease.
Is that because they're in the rural areas, or just lack of awareness even in the urban areas?
And that's why I love this month, Olivia, and love what you've given us. It's an opportunity to raise awareness, because most of the time people say, do children really get cancer? Yes, they do. Not as commonly as adults, but they do. And what is also different about childhood cancer is that it's 80% curable, more than 80% curable. So if you're going to diagnose, we are likely to cure them.
Okay, when it comes to diagnoses, first step, pediatrician, GP, and then they'll be referred to you as a specialist, hematologist, oncologist. So once a child has been referred to you, what is the process that you undertake?
All right. So maybe I could go back a little, and I found grandparents, I found parents who actually suspect something is wrong with their child. And they are the first initiating factor to look for a specialist who can tell them this is not cancer. Well, a lot of frontline health workers also should be able to pick out some symptoms and signs, although it misses them, but they can. And what I always tell healthcare workers is, if something persists, if it doesn't make sense, please refer to the next level. And if you suspect, that's good enough. Refer so that this child can either be confirmed, because early diagnosis saves lives. So once they come in, then we run a battery of tests. We have some diagnostic algorithms, and we are able to confirm or actually say this is not cancer. And if we confirm, then we take it to the next level.
So what is the treatment like? Let's say we have a case that's confirmed. They have a type of lymphoma. Pick one.
Lymphoma, you picked it. We're in the lymphoma belt. So let me run with lymphoma. So lymphoma is usually a cancer of the lymph nodes, which are part of your immune tissue. So once they come in and we have a swelling of the lymph node, we need to get a biopsy of that. So once that biopsy is taken, it's taken to the lab. We have a doctor called a pathologist. What they do, they put it on a slide, and they're able to tell us if they're cancer cells. Then they tell us which type of lymphoma it is. Now, once that is done, we do something called staging. So staging is to determine what is the extent of this disease. Because, we have stage 1 to stage 4. I know you hear a lot about that. So once we've staged, then we are able to tailor what we call a protocol or a treatment plan to the stage of the disease. So we find childhood cancers, we are very aggressive with them. And the reason we do that is because we really want to cure them. And that brings in the other fact that you asked me, is there enough blood? And what limits our intensity of treatment is actually availability of blood. Because
so can an adult donate blood to a child?
Yes, for sure. In fact, actually, most of the blood donors have to be adults, because you have to give consent. So the blood we use is really from adults. So we need to be able to have enough blood, because you go to a hospital like Kenyatta, they're doing a very good job, but then your child has the side effects of treatment, and they don't have blood. And that will limit the next cycle of treatment. That influences the outcome of that treatment. So basically, blood support, treatment for infections, nutrition, like Faraja is concentrating. That support for the patient is what really determines the outcome. I say that my job is so easy. Giving treatment is not hard. But supporting that treatment
is what's difficult.
Fatma,
you said that you're organizing a blood drive. 11th and 12th.
11th and 12th at Uhuru Park.
At Uhuru Park, not KNH.
No, it's going to be at Uhuru Park. KNH are the sponsors, so they'll be the ones who are providing all the equipment for that particular blood drive that is going to be undertaken that day.
So what happens for people who are like afraid or of COVID or exposing themselves? Like, are there going to be all the protocols in place?
Absolutely. We're going to have all the COVID-19 protocols in place. In fact, the Nairobi County has been gracious enough to provide us the grounds for free. So hence supporting it. And of course, we're going to ensure all the COVID-19 protocols are in place. And
sorry, continue.
Sorry. There's also going to be a City Health Hospital. Who's going to be able to give free, general observation to see if you have any issues. You're going to have also cancer screening on that day. So you can be able to, if at all you suspect or if you're fearful if you have cancer, then at that point, even your kids could actually go in and be able to be screened for cancer, but it should be a physical screening.
From what time?
From 9 to 5 p.m.
Uhuru Park, 11th and 12th September.
9 a.m. to 5 p.m.
9 to 5. Cindy, why are Kenyans so afraid of giving blood?
I think there's social stigma. Then there's also the fear of needles. I don't know if you guys have seen the hysterical videos going around of people getting vaccinated against COVID, and it's the adults are, they're ouching. It's just the social stigma of giving blood, I think. There's also social stigma about being diagnosed with cancer, which is unfortunately one of the reasons why most cancers in Kenya are diagnosed late, because people think if you have cancer, you're going to die, or if you have cancer, you have to sell everything so that, you can get the treatment done. So some people are like, better the devil you know than the angel you don't know. They don't get tested. And we were talking off mic with Fatma, and she and we were just talking about how in our parents' generation or grandparents' generation, cancer like breast cancer and cervical cancer, because of how they present themselves, our grandmother is not going to come and tell me my breast is swelling or I have a funny discharge and it's bloody and it's smelling, so she'll just be quiet, and then unfortunately the cancer will rupture her skin, it becomes a fungating wound, and then it's too late. So it's just social stigma, and that's why it's important important to create awareness that, and I like what Dr. said, that 80% of childhood cancers, if they're diagnosed early, are actually treatable. I don't know if it's the same with adult cancers as well, but it's, early diagnosis is always a good thing.
It saves lives. At co.ke, this intertribal marriage, I'm loving it. It's a woman who is taking on the role of the late Aretha Franklin, Jennifer Hudson, If This Isn't Love. How are you doing this morning? 00 Direct is the hashtag. I am Olivia Otieno, giving you 2 pairs of earpods, if you're lucky. Yeah, they're still up for grabs. Thanks to Follow Me Talk. Get onto our Facebook page, spicefm.co.ke. Let me know which is your favorite female artist from the 90s. Kikinyisa knew Jennifer Hudson. All right. I'm sure she's doing her thing, maybe bathroom yake, but she was not known in the 90s. Which is your favorite 90s female artist? At SpiceFM.ke is our Facebook handle. Now, we are talking about a very, very difficult topic. It is childhood cancer, because September is Childhood Cancer Awareness Month. And Dr. Great news that 80% of childhood cancers are treatable. But what is the percentage here in Kenya of those who get treated? I think awareness and early detection is a real problem.
So thank you that you asked that, because unfortunately that's not our story. Our story is at probably less than 20% survival.
No.
Yes, it's very dismal.
Yes.
And that's why you're doing such a fantastic job of giving us this opportunity to raise awareness, because what are our challenges? Why are our children dying? Yeah, they could be cured of childhood cancer.
Yes.
Because of late presentation.
Okay.
When they come in, the disease is so advanced that it's literally impossible to cure them.
Yes.
And yet we could if we had caught them a little earlier. So we need to raise awareness with the public, with our healthcare providers, so that we need to also start thinking how to invest, because people keep saying, I have to go to India to get cancer diagnosed. And I say, no, you don't have to. But we need to invest in our cancer diagnostics and cancer treatment. And also look into a way of making this cancer treatment much, much bearable for these families.
Yes.
A lot of health insurances don't cover cancer. They call it a chronic disease. So it's only left to either support trusts like Faraja or NHIF to really chip in, and the rest is borne by the family. So we really have to help these families get, and even have the government invest in treating children for free, because you can hear childhood cancer is a rare disease.
Exactly.
But we can't cure them, and we can do it right here in Kenya. And that's the hope that this month carries, that children are precious, children are golden,
yes,
and we should invest in them, and we should run for cure, because if we cure them, they have their whole lives to live and be very productive members of the world.
I like what you said. Government needs to invest in treating children with cancer for free.
True. And that is really not a publicist statement.
Yes.
It's really an advocacy, and we should, because sometimes you sit on the table and people say we only have 1 or 2 cancer cases, but they could be cured.
Yes.
And very easily. And most people ask, so how do we cure them? We cure them by giving them medicines we call chemotherapy.
Yes.
So we need to get access. We need to reduce the prices on that, make them available, and then surgery and radiotherapy. As you hear, we only have 2 probably big radiotherapy centers, which would either be Nairobi or elderly.
Yes.
So let's imagine somebody in Garissa who is sick.
Yes.
You have to travel all these distances to get radiotherapy. So I know there are big efforts happening to decentralize care, but I think we really need to quicken that pace of doing that and really, really run for it, because we can do something.
So the takeaway for today is diagnose, 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 go get the check, go get the check, go get the check.
And actually, early diagnosis, early detection saves lives. That's our catch statement. Childhood cancer awareness, children are golden.
Yes.
Early diagnosis equals early saving life.
And Dr. has just said that there are only 2 centers for radiotherapy, and that's why you're telling me that the trust is only in Nairobi and in Eldoret.
Yes, because it makes sense for us to be where patients are treated. If somebody is going in for their radiotherapy, which is at least 15, sometimes maximum 30-minute session, what are they going to do the whole day? They'll go home and start thinking about their cancer and thinking they're going to die.
Yes.
We want them to come to our center. Let them have a free cup of tea. Let them listen to music, read informative books. Let them get free counseling, nutrition, nutrition, let them sit and talk to people who have beaten cancer, and at the end of the day, they end up feeling better.
Do you have any virtual sessions? Because also with the outbreak of the pandemic, a lot of people were not able to travel. They were told to isolate. What does somebody do in the event that they can actually travel to where you are?
That's a great question, because of the pandemic, we actually went virtual, and we reached people who ordinarily would not have come to Faraja because it was too far. Even this month, we have a series of webinars where we're talking about risk factors and early signs of cancer, or even having a session for caregivers, parents who've taken care of kids with cancer.
Yes.
And all this is available on our Facebook page, Faraja Cancer Support Trust. So yes, our support groups at the moment are virtual. We're in the process of building a virtual center, so we'll have some people here, sort of like this studio, where we're here, but everybody else can see us live.
Yes.
So that's the same concept that we're going for, because the world is digital and we're embracing it.
Excellent, excellent. Advocate Fatma Mwiruri, I know, from Equity Bank. Vice Chair, Subi Queens. Tell me about all the events you have lined up for this Cancer Awareness Month.
Thank you, Olivia. As Dr. Doreen mentioned, awareness is very, very important. So on 11th and 12th of September, we're going to have a child awareness awareness activities at Uhuru Park, and it's going to be from 9 a.m. to 5 p.m. on both days. We're going to have blood drive. As Dr. has mentioned, blood is very important. So we're going to ensure that we are targeting 1,000 donors, and we're hoping we're going to get that 1,000 donors. And we're also going to have a car wash. So please come, bring your cars. It's going to be a drive-through whereby we're going to be doing all the executive cleaning for only 1,000 shillings, and all proceeds goes to Faraja.
Yes.
And of course, we're going to also have a city health hospital they're going to be able to give cancer screening and also do general checkups, just giving physician advice if need be on that particular day. Of course, there's going to be a pre-event, which is today at 2 p.m.
Yes.
Please do not miss at Splash Foam Spa. It's at Valley Arcade, at Adams Arcade. And of course, there will be a car wash for only 800, the executive car wash. Again, all proceeds goes to Faraja. Cindy here representing. Yes. And we're also going to go to a drive in Eldoret. Yes. As Cindy has mentioned, in terms of...
You're going to drive from Nairobi to Eldoret.
To Eldoret.
Yes.
To the Moi Teaching Referral Hospital.
Yes.
And what we are doing is trying to raise funds for children who have cancer and they're isolated because of COVID.
Yes.
And they're all isolated at Moi Teaching Referral Hospital.
Okay.
So we're trying to ensure that we can get as much as we can for them. And please, when you're coming for the 11th and 12th, please bring anything that you have, whether it's storybooks, it could be anything in kind, storybooks, toys, so then we can be able to give this particular children's some bit of hope, as Dr. Doreen has just mentioned. Hope is very, very important.
Wonderful. Thank you so much, ladies. I want to thank you, Dr. Doreen Mutua, Advocate Fatma Mwiruri, Cindy Ogana from the Faraja Cancer Support Trust. Go online, find out what these people are doing. It is amazing, and find out how you can support them.